I'm Nathan Haile. I'm one of the hip and knee specialists at Texas Orthopedic Specialists. I'm fellowship trained in hip and knee arthroplasty. Today we performed a total knee replacement using the robotic arm technology. Performing total knee arthroplasty with the robotic arm assistance enables me to have a little bit more control over the exact placement of the total knee that I put in. Prior to robotic assisted total knee replacement, each patient goes in for a CT scan of their knee. This provides a 3D image of each individual patient's knee, which can be used during surgery. In surgery, after the approach and initial soft tissue releases are done, guide pins are placed in the femur and the tibia to attach arrays, which look like little satellite dishes and allow the knee to communicate with the camera showing the computer where the knee is in space. Registration is carried out with the blue and green probes to further identify individual characteristics of both the femur and the tibia. After registration, the computer mates the CT scan with the points that were found with the probes to communicate with the robotic arm exactly where the knee is in space. After this communication is complete, the robotic arm can follow the knee in space no matter where it's moved. This allows the surgeon to have much greater control over cuts and fine adjustments to position implants specific to each patient's anatomy. While bone cuts are being made, the computer screen shows the color green where bone needs to be taken away and red if too much bone is taken away. The robotic arm has a haptic boundary which prevents the saw blade from moving beyond the bony surface and injuring any soft tissues. In order for a total knee replacement to have optimal function, it must be what we call balanced. That means the tightness in the knee is the same in flexion and in extension. Using the robotic arm technology, we are able to judge the flexion balance and the extension balance, as well as the balance on the medial and the lateral aspects of the knee prior to bone cuts being made. After the initial cut is made in the tibia, a tensioner is used to judge the gaps that the knee is going to require in order to have optimal function. This allows us to make fine adjustments prior to final cuts, which can provide for optimal balance and thus optimal function of the total knee replacement. I think the main myth related to robotic total knee replacement is that the surgeon is uninvolved or maybe out of control, or even that the robot has more control than the surgeon, and that is categorically not true. The robot is simply a tool that the surgeon is able to use to have a more finely tuned control over the way cuts are made, the way the knee is balanced, and the way the surgery is performed. There's no difference in the postoperative rehabilitation after a robotic total knee replacement compared to a manual total knee replacement. I still expect every patient to go home on postoperative day 0 or postoperative day 1. The patient that we did today was doing very well when I checked on her, and she's anticipating return home tomorrow.